Hi, good morning, Veronica. Thanks for coming in and giving us your experience on the procedure. So
Sure.
first thing I want to ask you is, how did you hear about us?
So I have a sister that works in the medical field, and she knew that I had challenges with my knee. So she was familiar with the process, and she actually did some research for me, and then she directed me to this location.
So what kind of symptoms were you having that made you want to seek help for your knees?
So I would say lack of stability in my knees. I had limited activity level. I could only do, so much physical activity before I would feel like I was going to lose strength in my knee. Every once in a while I have some pains, like a sharp pain if I moved a certain way or whatever. But basically my knees were just not allowing me to be as active as I wanted to be.
Okay. And overall, how was the procedure when you underwent the whole thing?
As far as like how did the procedure feel,
Mm-hmm. Yeah.
okay, so I would say that if you're a person who has been experiencing knee pain and you've gotten any type of injections before in the past, the procedure probably will not bother you much at all. You'll feel some pressure when the material is being injected into your knee, but it won't be different than any other injections you may have gotten in your knees before. For me, the part of the procedure that I had the most challenge with was, my terminology might be right, but when you extract the bone marrow
Yeah.
from the hip area, that actually bothered me more than I anticipated it would. And so I actually had more discomfort from that than I did from anything associated with my knees.
Okay. And then how was your recovery overall after the procedure?
So my recovery, I would say, was really rapid. From a knee standpoint, almost immediately, I felt like I had more stability in my knees. I felt like I could do more. I was a little frustrated because you have to wait, like a certain amount of time. I think it was 2 weeks before you do any
Correct.
type of activity. And I really wanted to start doing stuff because my knees were feeling so much better. I would say one of my hips, I had discomfort probably for about a week to 10 days. It was nothing that was not manageable. I would say for the first 3 days, I did take the pain medication that was prescribed, and then after that, I wound up not taking anything, not even any over-the-counter stuff. I was fine.
Fantastic. Now, how long has it been since your procedure, and how are you doing now compared to before?
Okay, so it's been just under 4 months, and I would say that I'm doing much better than I was before. And I don't have a lot of things to quantify it, but I can tell you that, like, prior to the procedure, if I walked like a mile, I would feel like I had to stop after that because I felt like I didn't want to get too far away from home and have my knee give out on me and then not be able to get back home. And then, like this past weekend, I was able to walk just under 4 miles. I didn't have any issues with my knee. I was just tired. And then I can tell you that I noticed since my knees are so much better that I have, I need to build up strength in my muscles, like in my quad muscles. And so I think that is probably the challenge that I'm working on the most now is just trying to get the muscles around my knees strengthened.
Very awesome. Thank you, Veronica. Is there any parting words you want to say before we close out?
The only thing that I would say is that in my mind, there are few investments that are more important than one's health and one's education. And so if you're considering this, I would recommend it because I think if you can put yourself in a situation where you're doing more than just maintaining, you're actually improving your condition, it's worth the investment.
Fantastic. Thank you so much, Veronica. I'm glad you're doing much better, and we'll see you soon. Bye.
Thank you. Bye.